All right, good evening, everybody. Thank you for joining us for tonight's session. We have the lovely topic of pressure sores and some hygiene awareness. And we are delighted to welcome back to the High Performance Department for this particular presentation, Notemba Tobela, who of course was our physiotherapist for the past few years, taking a bit of a break from it all. But thank you very much for agreeing to do this presentation, Notemba. And I will hand it straight over to you. Thank you.
Thank you, Jerry, and good evening, everybody. As Jerry said, my name is Notemba Tobela. I am a physiotherapist. So I just wanted to do this, or I was asked to do this presentation on pressure injuries and hygiene awareness for our players. So the first part I'm going to start with is just pressure injuries. You can go to the next slide. Okay, so these are just the headings that we're going to go through, but I'll go through them as we go through the slides as well. Okay, next slide. All right, so a pressure injury is also known as a pressure ulcer, wound, or the most common one is either pressure sore or a bed sore. And it's one of the most common secondary complications that wheelchair users get. Basically, what happens is, and because of the loss of sensation from whatever injury that you got, would it be a spinal cord injury or spina bifida, any of those, the area to the skin and the underlying tissue gets damaged due to pressure, friction, or shear forces, or a combination of those forces. So the damage is then caused by the disruption of the blood to the tissues, and then that prevents oxygen and nutrients from reaching that area of skin, and then that area of skin then dies. And it is usually common in the more bonier areas, so like your knees, your hips, the back of your thumbs, the elbows, those are the common areas. And deep pressure can occur within an hour without any signs of a pressure sore. And then between 3 to 9 days, that's when you start seeing the visible signs. So I think that's one of the dangers of pressure sores is that you don't realize it's there until you actually see the sign. We can go to the next slide. So I just needed to give some stats. There was a study done in 2012 for a Japanese national team, and they found that 45% of the male basketball players showed signs of small lesions. And in the same study for the female national team, there was about 68.2% of the players who also had the same problems. They are, like I said, common in players that have spinal cord injuries, and that's about 85.7% of them. And then those with skeletal system diseases, so that would be like your amputations, and that would be like 37.5%. Um, Players that use a wheelchair in their everyday life, they have an 84.6% chance of getting pressure sores than those who only use their wheelchairs for basketball only. And has been extremely noted that people or men and women that play wheelchair basketball are very susceptible to getting pressure injuries. Can we move on to the next one? Okay, so there are 4 stages of a bed sore, and then we're going to go through each one of the stages, and each one gets worse than the other. So it's always better to notice it while it's still in its early stages. You can go to the next one. Okay, so I did add more content to the bed sores. If you are very sensitive, I would advise that maybe you don't look at the pictures. They are bad. Okay, so we can go to the first one. This is just a summary, basically, of what happens in a bed sore and the common bony areas that are susceptible to getting it. So your head, shoulder, and shoulders. And then in our wheelchair basketball players, it's usually your sacrum, your hip bones, and your heels as well. And then this just shows on your right side the different stages, of which I'll show live pictures of as well. Okay, can go to the next one. Okay, so the first stage of a pressure sore, like I said, is usually a bony area, and it's either a red or a darker discoloration of the skin. And it affects the affected area will usually have a different temperature than your surrounding skin. And when you feel it, you normally feel pain and it's a bit firmer than the other areas. So while it's still like this, it's still red, it's not open yet, but you can see the signs that a sore is coming along. So that's usually the best time to actually get it sorted out, and it's easier to heal at that stage. Next slide. Okay, so then you get a grade 2 pressure sore, which is a partial thickness of skin loss. So that's when you start getting a break in that red area. And it's usually quite superficial, as either like an abrasion or a blister, like you can see in the picture below, or a shallow crease, like you can see on the picture on your right-hand side. Next slide. Okay. So grade 3 and grade 4 are the more severe pressure sores when they start opening up, but also extending to the other underlying tissue. So it starts extending down to the subcutaneous tissue, but not completely through to the underlying fascia. It usually presents as a deep crater, and it can have necrosis or without necrosis. So necrosis is just death of the tissue surrounding the area. At this stage, you are able to see fat, like actual body fat, but the bone and the tendons and the muscle tissues are not visible at that stage. And when it gets to this stage, that's when you usually want to actually start seeing a doctor immediately as an emergency. Next slide. The last stage is stage 4, and as you guys can see, it's quite severe. That's when there is tissue necrosis or extensive damage to the point where you're starting to see the bone, the muscle, and the supporting tissue structures. So literally in these stages, sometimes you are able to put your whole fist into the wound if it's that bad. And yeah, so you can also get slough or eschar, and eschar is like dark patches of skin within the skin. Next slide. Okay, so that's all the scary photos. There are 3 main causes of pressure sores. So it's either pressure and time, friction, and the most common one, but the most not noticeable one, is your shear forces. So your pressure and time is just surface pressure, which is determined by your weight, your size, and how long you stay on that area. This is due to direct pressure on the skin, again, over the bony areas. And because of that pressure, the blood is not able to flow properly. So then you either get swelling or tissue death, which then develops into the pressure sore. When it comes to friction, it's usually caused by the skin rubbing on another surface. So this could be a result of spasms or just how a person transfers and they keep scraping their skin either on the wheel or on the edges of their chair. And then with shear forces, it's when the skin tissue moves parallel to the supporting surface over stationary soft tissue. So basically what happens is the bone inside, so let's say the hip area, is moving against the skin while the skin is moving against your seat. And the reason that one is not noticeable is because then you start getting a pressure sore from the inside out. And by the time it comes out, it's already developed into a stage 4 at that point, and it's a bit too late when you notice it. Next slide. Right, so the common risk factors and complications of pressure injuries, you have external and internal factors. So your external factors are usually heat, moisture and sweat, trauma, medication, smoking, or alcohol and substance abuse. And the most important one for wheelchair basketball specifically is your moisture, sweat, and heat, which occurs a lot, obviously, during competitive games or even during practice. So pressure care is still important even between those times, and immediate showers and just wiping down in general and checking your skin integrity. Internal factors are reduced mobility, poor nutritional status and skin integrity. Incontinence, especially for our nappy users, they are at a higher risk of getting pressure sores than people that are on a bowel program. Sensory impairments, obesity versus being underweight. So underweight people have more bony areas, surfaces, so they are more susceptible to getting the pressure sores. And then you get your presence of comorbidities or loss of muscle bulk or muscle atrophy. Next slide. All right. So I just added a little note to the slide, but the biggest way to combat pressure sores is to prevent them from happening in the first place. I just looked at the stats recently, and as of January 2024, in order for a stage 4 pressure sore to heal, on average, it would cost that person 2.4 million rand just to treat it. So rather than having to treat it, prevent it from happening in the first place. And that includes staying off your pressure areas and staying in bed for a few months while that pressure sore heals. It can get frustrating, it can get depressing, and it is quite lethal. So rather, again, prevent rather than to get a pressure sore and get it healed. Next slide. Okay, so I just wrote a few prevention strategies for pressure sores. So pressure relief, reducing friction, and injury prevention are one of the easiest ways to prevent them. Doing a lot of skin checks, checking skin integrity daily can make a huge difference. Other things include adequate nutrition, avoiding too much moisture, daily skin inspections with the mirror. So every morning after taking a bath, every evening before going to bed, you need to do a skin check. Positioning yourself in a chair, your day chair, your sports chair, and in bed. And also just getting the correct size chair as well can contribute a lot to prevention. Check your mattresses at home, check your cushions, whether it's your playing chair cushion, whether it's your day chair cushion, and then you replace it as necessary. Wheelchair maintenance, which is something that's supposed to be happening yearly, which includes cushion review. Avoiding tight clothing because the seams can be a pressure area. Trying not to carry objects in your pockets or in your seats because they will dent and eventually cause a pressure area. Be careful around heaters, fires, direct sunlight, cigarettes, hot water, and then just carrying hot objects or drinks on your lap. Again, that's because of the sensory impairment. So if you're unable to feel it, you're unable to judge how hot it is, then it's a risk for injury. And then just some treatment techniques. So for your stage 1 pressure sores, it's something that can be handled at home or you can have handled at your local clinic. So it's simple, it's just resting and you staying off the affected area, so no pressure on the area completely. Massaging the area with ice to reduce the swelling, finding and addressing the cause of the pressure sore. Is it the cushion? Is it your bed? Is it the clothes? Is it because you're not doing your pressure relief techniques? And then just doing your skin checks and then applying your pressure relief techniques. From your stages 2 to 4, it is advisable that you then seek medical attention. And then obviously, depending on which stage you're on, they will address it accordingly. But usually it's done with dressings, hydrocolloid dressings, or normal saline and gauze dressings, antiseptics and antibiotics. And then in your worst case scenarios, they do consider surgery where they remove skin from one area of your body so that they can form a graft or a flap within that area. And sometimes that does work, sometimes the graft doesn't hold, so you never know which direction it's going to go. Next slide. Okay, and then I just included some pictures of pressure relieving positions. Pressure relief, you do it every 30 minutes for 2 minutes. So if you're going to choose, let's say, the position on your top left corner, then you stay in that position for 2 minutes and you do it every 30 minutes. So within a space of an hour, you need to have pressure relieved at least twice. Okay, and then the next slide. All right, and then the second half of the presentation is just focusing on hygiene awareness. Go to the next slide. All right, so hygiene awareness just refers to the conditions and practices that help us to maintain health and prevent the spread of these diseases. And then personal hygiene is just referring to maintaining your own bodily cleanliness, and it's just being mindful about one's hygiene. One of the big things that we need to look at is continence versus incontinence. So if you are continent, it means you're able to control your bladder and bowel. So if you need to go to the bathroom, you're able to feel it, you're able to hold it until you get to where you need to be. Whereas incontinence is when you have an involuntary loss of bladder and bowel control. So as a result of a spinal cord injury, maybe then you're not able to feel when you need to use the bathroom, so then you are deemed incontinent because you have no control of that. Next slide. All right. Okay, so it is important that then our players establish a bladder routine and a bowel routine. So most of the time, using linen savers or using a nappy is the easiest way. It's the most affordable way, but it's not always the most hygienic way, depending on your hygiene practices as well. And it also is a higher risk for pressure sores. So we try and establish as much of a bladder routine and a bowel routine as possible. So a bladder routine essentially is when you schedule how often you empty your bladder, and it's usually either every 3 hours, 4 hours, or 5 hours. It differs for every person. It is depending on timing and the amount of fluid, including caffeine and alcohol consumption, which can sensitize the bladder, which means then you go more frequently. So you need to be more careful about that. It reduces the risk of bladder infections or other health problems if you don't have a proper bladder routine. So then you're at a risk of getting urinary tract infections, bladder and kidney stones, kidney damage, and then eventually kidney failure. So it's just like you do your wheelchair assessment, it is important that you do a regular assessment of your bladder care with your health team as well. And then they will suggest the different types of equipment that you can use. So you can either be on an indwelling catheter, a condom catheter, or otherwise you do intermittent catheterization, which is a routine where you drain your bladder every couple of hours. If you are going to be using adult diapers, it is important that you use them properly and you use them timelessly so that the moisture doesn't ruin the skin integrity. Some people are able to do reflex voiding to empty their bladder, but it's not for everyone. And then sometimes you can get medication or Botox injections that help to relax the bladder muscles. So yeah, those are the different types of bladder routines that you can get into that would reduce the risk of pressure sores as well and allow proper hygiene. Next slide. All right, bowel routine is the same thing. So a bowel routine is a regular routine where you use a technique to empty your bowel either every day or every second day. Most people prefer every second day. This can be done in different ways, and there's different components that you can establish a bowel routine. So you can change either your diet or your lifestyle. There's going to be the use of suppositories or mini enemas, and the most common one is the use of medication. So like your Senecarts, your Movicals, and your Dalcolaxes. It is normally done at the same time each day so that your body is programmed to doing it at the same time almost every day or at the same time every second day. And usually a person is able to complete the routine within an hour or on a regular basis to prevent bowel and bladder accidents. Every person's bowel routine is very different and it's a trial and error process. But like I said, as soon as you teach your body to get into a routine, then it's much easier. Bowel routines can be complicated and they are time consuming, but they're very important for regular emptying and to prevent complications. So again, a complication that's linked to your pressure sores would be maybe, let's say, within a game and you have a bowel accident and maybe you're wearing a diaper, then you in that environment until you're out of the game or the game ends. That compromises your skin integrity. It can cause burns on the skin, and it is a risk for pressure sores. So it's actually better to establish a set bowel routine where you know what time and when, and it's always easier to prevent accidents from happening. Next slide. All right, so complications of a poor bowel or poor bladder care, sorry. For your bladder, it's like I said, your UTIs, you can get urinary incontinence, kidney and bladder stones, and then that can also lead to kidney failure. For your bowel, it's bowel impaction. So that's when it's like a severe form of constipation. There's constipation or diarrhea, or you can get fecal incontinence, or if it's really bad, then it can lead to hemorrhoids as well. Next slide. Okay. So it is important to know about bladder routines and bowel routines because most players and most people in general don't know about it. And that's why they never establish it. And it's a good routine to bring in within games and practices as well to make sure that you prevent your pressure injuries and you're still maintaining good hygiene. So a few hygiene tips. Washing your hands before and after any bowel or bladder routine, especially if you're regular wheelchair users, because those same hands are pushing you, those same hands are transferring you. So you need to make sure that you keep clean hands. Wearing gloves always when you're dealing with your bladder, bowel, or any wound management. Regular sanitization of your wheelchair. Taking proper care of your cushion. So if you do have accidents or something happen with the cushion, immediately it needs to be wiped down and dried out so that it doesn't retain the smell and it doesn't ruin the integrity of the cushion. It's also important that they have cushion covers, preferably waterproof, because then at least that preserves the integrity of the cushion, and the cover can then just be washed like anything else and hung and kept clean on a daily basis. Regular showers before and after games due to the excessive sweating to prevent moisture buildup. If it's an adult diaper situation, they need to be changed and checked regularly due to the moisture buildup, and then that also reduces skin integrity and pressure sores. Regular skin checks twice a day, morning and evening, regular checkups with your medical team, and then just in general, maintaining a good diet, nutrition, and keeping hydrated as well. Next slide. Okay. Yeah, so I still have some of the COVID-19 tips, but I think these apply in general. But basically, it's just keeping clean hands, making sure that your wheelchair is clean and wiped down on a daily basis, and still wearing your mask now, even now when you're surrounded by people that are sick or you yourself are sick. Next slide. Yeah. So just to highlight the key points, like I said, prevention is better than cure usually, and protection, pressure care and positioning is very important, and it is the biggest factor that can help with prevention of pressure sores. And then just general cleanliness and good personal hygiene and always checking, always being vigilant can prevent a lot of things from happening, and rather be safe than sorry. Yeah, next slide. Okay, and then just final words, always remember 2 minutes of pressure care worth more than 2 years in hospital and now 2.4 million rands as well. Washing your hands regularly, and then in general, just keeping safe and fit and healthy. Next slide.
No, that's you done.
That's last one. Yes. Okay.
All right, thanks, Natemba. Let's open the floor to any questions for Natemba. As we highlighted before, it is a very important topic, and you know, over the years, and sadly, we have lost quite a few of our players and members to pressure sores. So please, if you have any questions, now's the time to ask. And if you'd like, I can put those pictures back up for you just to ruin your dinner.
I hope no one ate before this. Sorry, should have said that earlier.
Any questions, guys? Sipa, any comments from your side?
Yeah, no, this is a good presentation, Natemba. Well done. And I just want to put a lot of emphasis, especially to the younger players that are coming up, to, you know, especially with the coaches as well, that you guys really stress this point of pressure sores and hygiene from the young age. It's very, very important, and just to make sure that we don't lose our players. And Latin is quite right. We've lost players like 2-3 years ago, and some of the players still have those pressure sores, and they out of basketball because they cannot continue playing because of pressure sores. So it takes a while to really heal if it's on level 4. So the younger, you know, to start, you know, implementing or maybe informing them about this at the younger age, it will help, as they grow older, and how important it is to stay healthy and emphasize and put more emphasis around hygiene as well. And then in terms of the cushions, yes, the most challenging element there is like most of the athletes who will not afford to have maybe one or two, to have two cushions or more. But in a case, if they can afford to buy an extra cushion, it is important that they are able to, if they have an incident, they are able to take those cushions, because most of the cushions are foam, so foam just tend to absorb the moisture and also maybe urine, and that actually brings or increase risk of quicker pressure sores. So like even when I'm traveling, with my players from Durban to Johannesburg, we have to sit for 7 hours. I have for all of them, I've supplied cushions, for traveling. They don't use their day-to-day cushions, so they've got special cushions that I should give it to them so that they use those cushions, just to make sure that we try to minimize the risk, not necessarily going to stop them, pressure sores, but to minimize the risk to pick up pressure sores. So beautiful presentation, Natemba. Well done. Thank you.
Thank you.
Natemba, question in the chat from Sizwe. He wants to know how long in general does a pressure sore take to heal?
It's a difficult question because it depends on how bad the pressure sore is. So if you have, let's say, a grade 1 pressure sore, usually that within about 2 to 3 days it should heal. Your grade 2s and 3s depend on the management of it. Your grade 4s usually take over 2 years. I've had patients that it's taken 4 or 5 years for it to completely close. And that's with good management, which is always the problem. So the person who's managing your pressure sore, or the clinic, or whoever, they need to be managing it well and dressing it well and cleaning it well. But it can range from 2 to 3 days for your stage 1s to 4 or 5 years for your stage 4s. And that's 4 or 5 years of lying in bed, by the way. No sitting, no nothing. You're just lying in bed, either on your stomach or on your sides for 5 years.
So the message there is try not to get a stage 4, please.
Yes, please don't.
All right, and thanks for that question, Caesar. Any other questions?
Just another thing I'd like to mention. Something that I've picked up over the years, having conversations with players. It is difficult to, let's say, do your pressure care and manage your bowel and your bladder routine in game situations. And we have not yet figured out how we can play around that. So that's something that I want players to be more mindful of. And if we could figure out a way between coaches and players to navigate managing, especially for our nappy adult diaper users, usually that's when they mostly start in a competitive situation. And then they just don't care for it until after the tournament, which might then be too late. So it's just something to keep in mind and see if we can explore around how we can work, figuring that out and sorting it out. It's difficult, but it's just something to throw out there.
All right. Katlecha, I saw you had your hand up there for a second.
Yes, I did. And then I forgot my question. And then I remembered my question. Hello, everyone. So I actually wanted to ask what Natemba actually just responded to now is how do we go about having that conversation around bed sores and hygiene and all of that, especially like not as medical professions, like as team managers and that kind of thing, because I think it can be very tricky. So I'm glad she spoke on that. And then my question is, it's a very random question, but in my experience, the learners or the players that I've been to maybe summer games a lot with summer games, they tend to hide their pressure sores. We tend to find out a little bit later on, which is quite scary. So what is this is a very, very silly question, but what is the smell of the pressure sore? Like what can you pick up and how is that different from like a normal, odor type of thing? Like how can you pick up a pressure sore without actually having to see it, especially when the player is very reluctant to tell you about it, if that makes sense.
So it is a very distinct smell, but I think you had to have smelt it before to recognize it. So I don't know how to describe it, because usually you have to differentiate, is it just a pee smell, which is usually your cushions, or it's like a mixture of like your pee and your bowel smell, but it is very foul. It's different from your pee and your bowels. It's quite foul, but I'm not sure what I can describe it to. It's one of those things where you can smell it, you can pick it up if you're used to it. If you're not, you'd have to smell it so you can see how foul it smells. So yeah, I don't know what to tell you. I can't pinpoint a specific odor. Yeah, but I do know that players tend to, like you said, they are very reluctant and you pick it up late. And sometimes it is also a self-conscious thing as well. But what I've noted with players as well is that they have specific people that they are comfortable with having conversation with, and it's also about the approach on how you approach them about that conversation. You won't get it the first time around, but I think the more you have, almost like normalizing that amongst them and just asking in general, how's this, how's that? Some will open up, some won't. We won't always pick it up, but if we can pick up as many as possible, it's always good. And then your coaches, normally, coaches have helped me a lot. They can pinpoint which players exactly you need to be paying more attention to. And that does help, because then you can build some level of rapport to make sure that you can check in with them if they are closed off. I don't know if that answers part of the question.
Yeah, it does. I think, like you said, with the smell, it will take a lot more experience, but I think that was the scary thing for me, only finding out later and because someone else picked it up. But also, just as a comment, thank you so much for such a great presentation. I knew about pressure sores at a very basic level, but I wasn't aware of the stages, as well as the how to relieve the like when you're sitting for too long, the times and all of that. So thank you for that.
No problem. You're welcome.
Can I just come in there, Jerry?
Yeah, go ahead.
Okay. And also, guys, I think Katlok, you bring up very important question there. I think that's the reason why we have such presentation, and also for us to have that relationship with the players, that we don't hide this. We also speak to them and show them, and train them around pressure sores and hygiene from the very young age. And yes, it's very, very it's easy for us as coaches to identify players. And probably you guys have seen us, especially with the national team, when we stop the sessions or the trainings, because we could pick up that there's a certain, player in the team that does need to go to the bathroom, because players, they just want to continue playing and they just want to keep on running. But you could tell that there is a bit of, a hygiene issue there. Then we have to stop the training and we send everybody, to go maybe freshen up a bit. And then maybe we'll have one-on-one discussion with the player that we feel needs to be sort of made for clean and for cleaning himself for herself. Previously, we used to, our coaches used to check us, before we go for any competition. They make sure that they check us, they make sure that, everybody, that goes for any tournament is fully fit to compete. Because of really, if we as coaches have found that we've sent or maybe registered or flying players that are around the country that have got pressure sores, illegally we may find, we make it out of charge for that. So it is imperative that from the young age and even at the school level, start talking to the players about pressure sores and hygiene, and start showing them these pictures. And that will also help us in the long run to reduce the number of players that we have lost through pressure sores in a game, and that those that actually still keep on hiding those things, then can feel free to, like November said, to start talking about them and maybe, speaking about the issues and problems that they have. And one biggest issue that I found is players using same cushions for basketball, and then they take the same cushion, they use it for the day chase, so try by all means limit that from happening, stop that from happening, because it's one of the major sources of pressure sores. And yeah, but that's a very good question that you're picking up. But you gotta have a relationship, with players and or patients that you actually start discussing about these methods. Those are very crucial, in the sport that we do. Thank you.
Thanks, Super. Martin, you had your hand up.
Yes and no. I did have a question. It's just been answered.
Okay, perfect. Thank you. Question in the chat from Sizwe again. He's saying maybe this question is for Spa or Jerry. If a player wants to play Paralympic finals or whatever, and you discover that they have a pressure sore, is there a rule in basketball that prohibits them from playing despite their wishes? Good question, Sizwe. So from a WBSA perspective, we make sure that before we travel to any tour or any tournament, our head of medical, Dr. Rias, will check all players, and I can assure you that any player with a pressure sore will not take part, no matter what their wishes are. It is obviously very serious, when players have pressure sores. And we certainly do not want to be responsible for allowing them to play, and then they fall terribly ill and pass away. So that's just not a non-negotiable from WBSA's perspective. From the rules, RWBF rules, that's actually a very good question. I am not entirely sure, so I'd have to double check on that. Unless Sipa can assist me on that one.
No, the certain this is you spot on there, Mr. Smith. Now no one should be allowed to be on a wheelchair if they've got a pressure sore. So as Nothemba alluded earlier, if you have a pressure sore, you gotta stay off your wheelchair, for a certain period of time until that pressure sore is fully healed. You're therefore not allowed to participate in any sport if you do have a pressure sore. I'm not sure of the regulations in terms of IWBF, but medically, obviously, as Nothemba pointed earlier on, that you do not actually stay in a chair if you have a pressure sore, especially if it's stage 1. So it's easier to get that one healed. But if it starts to go to stage 2, stage 3, stage 4, then you know how that pressure sore is quite serious. So you cannot sort of stay in a chair at all. It's a no-go area, basically. Thank you.
Yeah, Sizwe, I mean, we've had players that we've prevented from going with pressure sores. Yes, unfortunately, they do get grumpy with us, and often WBSA gets accused of how badly we treated the player because we didn't allow them to play. But ultimately, we've got their best interest at heart, and from a health and safety perspective, it's not worth, for the sake of going on a tour somewhere, to lose your life over it. So from a WBSA perspective, we definitely will not allow a player with pressure sore to travel, and we then suggest that they obviously get the necessary medical treatment. Hope that covers everything there. Any other questions? Go ahead, Katlego.
I just want to, maybe this might be a very simple question to ask, but Nothemba spoke about how the stages are there, right? And then the fourth one is obviously the most intense one, and then there is obviously hospitalizations and all of that. So after they've done like the appropriate treatment, who is the person that clears them to maybe play? Or the person that says, okay, now the wound has sort of healed and they are allowed to play? Is it the physio? Is it the doctor? Is it the treating nurse? Is it like, who clears them to say they can play?
So I'll come in here. Quite simple, Dr. Rias. So obviously Dr. Rias is WBSA's medical officer in charge of that. Any player, again, what we do before we travel, we send, well, Dr. Rias will come through to Mandeville before we leave, and he will check up on all players, not just for pressure sores. There could be other illnesses that maybe we're not aware of. And, you know, as we are all aware, a player will hide an illness because he just wants to play or wants to go on tour, whatever the case is. But Dr. Rios is quite wily, and he'll pick up you know, any problems. So again, after the fact, once the player says that they're all better and they want to play again, Doc Rios does another double check, and if he says that they are okay to play, then we will allow them to play. Unfortunately, we have had instances in the past where a player traveled overseas suffering with HIV, and got his doctor, well, had presented a doctor's letter from a private doctor saying he was all good. He went on tour, fell very ill, and 3 days after he got back from the tour, he passed away. And in an investigation, it was found out that that player had actually forged a doctor's certificate. So we won't accept any other doctor's clearance other than Dr. Rios. Alrighty. Any other questions? If not, thank you all for your attendance tonight. I hope that was informative, and if you have any questions or queries after the fact, I'm sure Natemba would gladly give some advice. But yeah, just from my side, once again, I just want to thank Natemba for giving up some of her busy schedule to present for us. And yeah, so if there's nothing further, we can adjourn tonight, and we'll send the recording on the group. And thank you once again.
Awesome. Thank you so much.
Thank you, everybody. Thank you, Jerry.
Thanks,
Thank you,
Natemba.
guys.